Hey everyone, I'd like to welcome you to Arosa Central Coast's hiring session. And today we have Megan Peterson here today, who is a care specialist and a recruiter as well. So go ahead and take it away, Megan. I'm going to stop sharing and then it'll be your turn to go ahead and share your screen.
Great. Hello, everyone. Welcome. My name is Megan. I am recruiter / care specialist here at Arosa Central Coast, and we provide caregiving services to the elderly and others around the area. So who we are, our mission is to attract, train, retain, and treasure the best care professionals, as well as to create superior models of care that serve the greatest number of clients in the area. And we do cover all the way from Paso Robles and a little bit north of there, all the way down to Carpinteria, and hoping to get some clients down in Ventura. So we cover a really large area in the Central Coast, and are always looking for amazing caregivers. So our promise is to elevate the experience of care for our teammates, our clients, and their family members and loved ones. So we have an integrated care model that we have formed after, years and years of experience, that we know can ease the burden placed on our clients and their loved ones through a combination of care management and hands-on assistance of the professional caregivers. And we just believe that creating better jobs for our care professionals results in better care for our clients. So we do offer training for our caregivers, even if you have only had a little bit of experience or, cared for a grandparent or aunt or uncle. We hire a lot of people where their experience might not be formal, but it is relevant and important. And, they're like, oh, it's not on my resume, but that doesn't matter. If you help to care for somebody, then that is great in our eyes. And we will help with all the training that you need. So we are hiring actively. If anybody is in their nursing programs or getting a CNA or anything like that, this is a great way to, have something on your resume as you're working towards your license or whatever it is that you're working towards. This is just a good way to gain experience in the field and earn some money. So another thing that we offer, which is really, really wonderful, is our caregiver bonus and referral program. So if you want to be a caregiver and you know others, family members, friends, classmates, who are also looking to start their careers, and you refer them to us, you will earn automatically $100 bonus if they're hired. And after they work 16 hours, you will start earning 25 cents for every hour they work. So if you were to refer 4 people and they all start working, they work their 16 hours and they're working pretty full time, you would effectively give yourself $1 raise, which is really great and very easy to do. So we very much encourage this program. And I've seen a lot of our caregivers just get extra money in their bank accounts by this way. So currently we have a few open positions. Caregiver is one, and I'll talk about that. And we're not just hiring one caregiver, we're hiring as many as we can, because with more of a caregiver roster, we're able to accept new clients. And so we're at a point now where we're not able to accept as many clients as we want to because we don't have people to care for them. So as we build out our caregiver roster, we're able to have more work available for everyone. So as a caregiver, what you would do is really support our clients. The job is a lot of companionship. It is personal care, taking them to appointments, medication reminders, helping them move around and transferring them in and out of cars or their bed, and, keeping them company and happy. So you would also receive consistent coaching and support from a care manager who would, manage the client and all of their needs. We also, as a caregiver with Arosa, you would be eligible for financial awards if you have any sort of extraordinary care and assistance, and that is a really awesome thing that we have going that started in the pandemic. So if any hardships come about, we have this amazing grant that our caregivers are able to apply for if they're in need of extra help. And then we also celebrate our caregivers on a very regular basis. So we have the CSET Celebrating Caregivers Award that highlights the impact and good work of our teammates, and that is on a monthly basis. And if you were to receive that, you'd get $250 and recognition and a certificate and everything that says you're amazing. So our compensation starts at $17 an hour. Actually, I missed putting something on this slide. Compensation starts at $17 an hour. But if you were to care for a couple, so a husband and wife or husband and husband or wife and wife, it's 2022, that would start at $19.50 an hour. And so that is one of our open positions. And then our other open position is for a care manager here in Santa Barbara. So we're really looking for somebody who's really eager to enter the field. So if you're a new graduate or going to be graduating from the CNA program in the coming months, or we would be very interested in talking with you. So our care managers work with the clients as well as the clients, trusted circles of family and friends, as well as the caregiver, to ensure that there's a holistic care experience for our client. You typically have a credential in social work or nursing or mental health or social work or something like that. And it does take a special professional who is comfortable with older clients, their families, as they are with trust officers, attorneys, and physicians. You would be the person responsible for setting doctor appointments if that's needed, if they have, care management, and doing the medication setting and picking up of medications. Our caregivers do not, the caregivers do not administer medication, they just give a medication reminder, and then our care managers are the ones who are going to fill those prescriptions. So we're looking for somebody who has, confidence in what they do, who can convey that we are, truly there to help and can be trusted with their needs. And so this job is, 2/3 of the job is direct work with the clients and their family members and providing caregivers oversight. So you would be, supervising the team of caregivers that are working with your clients. Based on training and experience, conduct professional assessments for the clients, develop a care plan, and manage that plan. Involvement in the implementation of needed services. So if the client needs physical therapy or, new, vision prescription, that you would be in charge of getting that all sorted out. And then just providing general oversight and always reassessing their clients and their needs on a very regular basis. It's a requirement that our care managers go at least every 60 days to our client's house to assess how everything is going. And then 1/3 of that would be professional outreach. So being in the community, participating on local committees and task force, and participating in education and presenting to professional groups and raising the consciousness and helping professionals learn about how we can help them and help their clients and their patients and their families. And so setting up meetings with those people, getting to know them and figuring out what their needs are so that we can best help them moving forward. So benefits and pay, our caregiver compensation starts at $17 an hour, and couples care, oh, there it is. I did put it in the presentation. It starts at $19.50. And care manager compensation definitely, it depends on experience. That's something that our area director would talk with you about if you're a good fit. We do also offer medical, dental, vision, and 401k benefits for caregivers and care managers alike. And then just some extra bits of information to know is that our caregivers do need to be registered as a home care aide with the Department of Social Services. And that registration is valid for 2 years. And that it's really just a fancy background check that's run on you and allows you to work in somebody's home with, everybody having that peace of mind that the person there is, trusted and all of that. We also require a TB test, which is pretty easy to get at our local med centers or Sansum or wherever you go. Pretty easy to get a walk-in TB test. And then we also run our own background check on all of our applicants. So those are I would call them minor hurdles to get over in order to get hired, but all of it is pretty simple, and I am an expert in figuring this all out, so I can help with any of those steps if needed. And then if you're interested in applying, you can point your phone at the screen and click that QR code. It'll take you straight to our application, or you can visit arosacare.com/career, select Central Coast, and apply as either a caregiver or a care manager. And I will see you in there and be giving you a call. And if you want to reach out directly to me, that my email is up on the screen, megan.peterson@arosacare.com. And our phone number, this is our main line. So if you're searching for me, definitely ask, because several people answer this phone, 805-687-8766. Happy to answer any questions about caregiving, about the role in general or what's required and all of that. So I'm happy to be here for you in your search. I think that's it.
Thank you, Megan. That was wonderful. I think I needed to say at the beginning that my name is Jana Mori and I'm with the Career Center. And we will be posting this recorded presentation on the Career Center website if you ever want to go back and look at it, for those of you who are here today. With that, I'm going to go ahead and turn off the recording and we'll move forward with student questions.